The decline in parasitic treatment isn't just a coincidence, it's a byproduct of how the pharmaceutical industry chose to follow the money. Let's break it down with facts and figures. 1. The rise of autoimmune drugs. In the 1950s, treatment for inflammatory conditions like rheumatoid arthritis began with corticosteroids like prednisone, produced by companies like Merck and Pfizer. This marked the beginning of a shift toward immune suppression to manage symptoms. By the 1980s, methotrexate, originally a cancer drug, was repurposed to treat autoimmune diseases. Pharmacia and Upjohn, later acquired by Pfizer, marketed methotrexate for rheumatoid arthritis, solidifying its role as a long-term treatment strategy. However, the true game-changer was biologics. In the 1990s, biologics like Humira, AbbVie 2002, Enbrel, Amgen 1998, and Remicade, Johnson & Johnson 1998, hit the market, targeting specific immune pathways. These drugs generated staggering profits. Humira alone brought in $21 billion annually at its peak, making it one of the highest-grossing drugs in history. Meanwhile, drugs like Lyrica, Pfizer, used for fibromyalgia, often misdiagnosed alongside parasitic symptoms, raked in $4.6 billion annually. The long-term treatment of these chronic conditions created steady cash flow for pharma giants, keeping the focus on symptom management over actual cures. The decline in parasite treatment. While autoimmune drugs flourished, antiparasitics, like albendazole and ivermectin, remained cheap and effective, but rarely used in developed nations. Albendazole costs around $30 to $100 per course of treatment. Compare that to a lifelong biologic treatment like Humira, which could cost $84,000 a year per patient. As developed countries like the US embraced the narrative that parasites were a thing of the past, thanks to sanitation, doctors stopped testing for parasitic infections. Yet, studies show parasites like Toxoplasma gondii, infecting 40 million Americans, and Blastocystis hominis, found in 30% of IBS patients, are still prevalent. Parasites mimic symptoms of autoimmune diseases, such as chronic fatigue, joint pain, and digestive issues. But why test for parasites when you can sell a biologic instead? 3. Profits over cures. Here's the uncomfortable truth. Treating parasites is not profitable. A short, cheap course of antiparasitic drugs could cure conditions that are otherwise managed indefinitely with biologics, pain relievers, and anti-inflammatories. Companies like AbbVie, Pfizer, Johnson & Johnson, and Amgen have no financial incentive to promote antiparasitic treatments when autoimmune drugs bring in billions annually. For example, Humira's revenues alone dwarfed the entire antiparasitic market, which remains niche and underfunded. Pharmaceutical companies aren't in the business of selling cures when they can keep customers paying for lifelong symptom management. 4. Delusional parasitosis. The DSM-5 label, adding insult to injury, the mental health community now recognizes a disorder called delusional parasitosis in the DSM-5, 2013, a psychiatric condition where individuals falsely believe they are infested with parasites. Given the context, it raises questions. While this diagnosis does apply to cases of psychosis, some argue it can be weaponized to dismiss legitimate health concerns about parasitic infections, labeling those who question the system as delusional. The timing is curious. As parasitic infections became increasingly overlooked and autoimmune drugs dominated, a psychiatric label conveniently emerged that could be used to silence patients questioning why their symptoms were not being tested for parasitic causes. It begs the question, is it easier to label someone delusional than to acknowledge that we might be misdiagnosing millions of patients? 5. Conclusion. The rise of autoimmune drugs, particularly biologics, directly correlates with a decline in diagnosing and treating parasitic infections. With biologics like Humira bringing in billions each year, the pharmaceutical industry has a vested interest in managing chronic symptoms rather than curing the underlying causes. Meanwhile, affordable antiparasitic treatments are neglected, and those questioning this shift risk being labeled delusional. The system is built to follow the money, and right now, it's not chasing cures, it's cashing in on chronic illness.